Ahora sí ya tenemos al profesor Worthington desde Estados Unidos. Entonces la charla va a ser en inglés, entonces me voy a pasar al inglés ahora para darle la bienvenida. So, thank you very much, Professor Worthington, for being here today with us. We are really delighted to have you here with us.
Yes, I'm glad to be here. It's very early in the morning here in Virginia, so it's good to see you.
Yes, we are aware of that. So yeah, so thanks for being here. Just a little introduction about Professor Worthington is an emeritus professor of psychology at Virginia Commonwealth University in USA, and his research interests include forgiveness and other virtues such as humility. He has written over 30 books on topics including forgiveness of others, self-forgiveness, character strength, religion and psychology, and couples therapy, and he has published over 350 scholarly articles and chapters in different books. He's one of the external advisors of our research group of memory and reconciliation in Barcelona. We are really delighted he can participate today in this webinar of his history. So you got 20 minutes, and after that, we'll have another speaker, and after that, people will be able to ask you a few questions at the end.
Great.
Thank you.
So I'm sorry not to be able to speak with you in Spanish today, but my Spanish is not very good. So I'm going to, in order to try to stay into 20 minutes, I'm going to stick to a script very closely. So in this talk, what I'm going to do is cover 5 topics. What is trauma healing? What are the roles of forgiveness in trauma healing? How can we forgive better? What's reconciliation? And finally, I'm going to try to put those together in terms of forgiveness, reconciliation, trustworthiness, trust, and hope, and how that's related to peace. It's a big agenda for 20 minutes. So let me start with what is trauma healing? And I'll start with asking what trauma is. So trauma, of course, results from an exposure to an incident or a series of incidents that are emotionally disturbing or life-threatening, and that have lasting effects on the person, such as flashbacks and unpredictable emotions and other effects. And those effects affect the functioning of the person, so that that traumas now can then be acute, they can be chronic, they can be complex, and they can have a secondary or even vicarious causes. So importantly, a trauma is centered in an individual experience and not a trauma event. I think a lot of people these days seem to confuse the trauma event that is a potentially traumatic event for people with trauma. So people will say, you know, I experienced a trauma of a flood. Well, you know, many people, in fact, probably most people, do not react with a trauma reaction to a potentially traumatic experience. People are amazingly resilient and bounce back from that. So if a person does experience a trauma inside himself or herself and has these symptoms, then there are several good treatments for post-traumatic stress disorder. And probably the 2 most evidence-based treatments are prolonged exposure and cognitive processing theory. But of course, there are other important, I'm sorry, I just saw some friends of mine. So there are other important and effective treatments, such as cognitive therapy or cognitive behavioral therapy, or eye movement desensitization and reprocessing therapy, or even narrative exposure therapy. And those can be effective for different populations. They don't quite have the evidential support that the other 2 do. So what are the roles of forgiveness in healing traumas? Well, potentially traumatic events, maybe excluding natural disasters and accidents, occur at the hands of others very often. And therefore, forgiveness can play a part, it can play an important role in the healing of trauma or in PTSD. So what is forgiveness? Well, I believe that there are two types of forgiveness. One type is to make a decision that you're going to act differently toward the person who harmed you. So I decide that I'm not going to try to get even with them or get back at them or take revenge on them, and I'm going to treat them as a valued and valuable person. So we call that decisional forgiveness. But a person can make a decision to forgive and carry it out for the rest of their lives, and nevertheless feel emotionally upset every time they think about this incident. And that suggests there must be a second type of forgiveness that we call emotional forgiveness. So emotional forgiveness is the emotional replacement of negative, unforgiving emotions such as resentment and bitterness and hate with more positive, other-oriented emotions such as empathy for the person, or sympathy, or compassion, or even love for the person, especially in the case of romantic relationships where hurt has happened. So unforgiving emotions usually change slowly, whereas decisions might take a long time to arrive at, but once we make a decision to forgive, it's something that happens quickly and can be kind of like turning on a light switch. So there are those types of forgiveness within a person, decisional forgiveness and emotional forgiveness, but there's also societal forgiveness. And societal forgiveness is very different because it is about an official statement by a government that has the authority to issue such a statement, that either requests forgiveness, apologizes, or makes some statement that they grant forgiveness to a body that has wronged them. Of course, we individually can have intergroup forgiveness, where individually I experience decisional or emotional forgiveness toward a group of people, but that's still an experience internal to myself. So how does forgiveness take place? What are the mechanisms of forgiveness? Well, forgiveness is rooted in an internal perception of an injustice gap. So an injustice gap is a subjective perception of the degree of injustice or offense that I am experiencing right now. So the size of that perception of injustice can change as a result of things that happen. So that if a offender apologizes, and I know that that's hard for them to apologize, then that reduces the amount of injustice that I feel, because I feel that some justice has happened. If the person seeks to make amends or reparations for what they did, then that again reduces that injustice gap further. So there are many good ways to reduce that size of the injustice gap. Forgiveness is really only one of those ways, and therefore we always treat forgiveness as a choice that people can make or not make, because they have lots of good opportunities other than forgiving. Those opportunities include working for justice or seeing justice happen in, say, the justice system. They could include turning the matter over to God and relying on divine justice happening or turning the matter over to God by just relinquishing it to God. It also could be a psychological reduction of the sense of injustice by minimizing the amount of hurt, or if the person has been making a catastrophe out of this, to become more realistic in the way that they see the hurt. And so those are ways that injustice gap can be modified. There are other ways, such as tolerating an event and just saying, well, regardless that it upsets me, I'm going to just put up with it. Or I could forbear, which is to basically tolerate the event, but do so for a good reason, and that would be to preserve group harmony. Or I could just accept that life happens, bad things happen, I'm moving on. There's a type of therapy called ACT, or acceptance and commitment therapy, that uses acceptance methods to help people deal with injustices. But of course, forgiveness is a way that these gaps can be dealt with. So forgiveness also is able to reduce the amount of offense through the emotional and the decisional forgiveness. And it also can help people heal from the wounds of if they're experiencing a trauma. So the way that forgiveness heals trauma is several different ways. So first, forgiving can affect people's attitudes toward previous enemies by damping retaliation and or by reconciling. It does that in several ways. One, it can signal a perception of trustworthiness, so that by forgiving this person, I can signal to them socially that I see them as beginning to try to be trustworthy. Forgiveness also creates a desire to reconcile. We may not follow through with that desire because the person or the entity might not be acting in a trustworthy way, and we decide we're not going to reconcile even though we may forgive. And then forgiveness can help heal trauma because people perceive that the person has forgiven. So if I make a decision to forgive and I act differently toward the person, they can see me acting differently, and they take that as a signal that I have changed. Another way that forgiveness can help heal trauma wounds is to make entire communities or societies more aware of the forgiveness, and therefore more people in the community or society practice forgiveness. Third, it can drive people toward time-intensive ways of trying to forgive. So a time-intensive way might be to practice an intervention of some kind to promote forgiveness, and that people spend time doing that. And research has shown that the more time people spend trying to forgive individual harms, the more they will actually forgive. Fourth, trauma wounds can be helped by forgiving, because both community awareness and personal effort to forgive can affect public health and peace. The more that people experience forgiveness, that's been found to be related to health in a number of ways. And fifth, in countries where religion is highly valued, forgiveness, whose historical roots are in religion, although we've given a scientific basis to it also, but that forgiveness in religious societies can be acceptable to many people, and therefore something that almost anyone can practice. So understanding the benefits that forgiveness might have has measurable effects. There are three different categories of benefits that accrue to the person who is forgiving. So first, there are relational benefits. So if I make a decision to forgive and I start treating the other person differently, then that person can see that I'm treating them differently, and they often will respond in kind, as long as I'm careful and don't leave myself open to being taken advantage of. Of course, emotional forgiveness also can affect relationships, because if I emotionally forgive, I'm not as driven to maybe get back at the person, and therefore I change my behavior. So the second category of benefits is mental health benefits. Mental health benefits are related to forgiveness, usually because when people forgive, they reduce rumination about the wrong. So rumination, of course, is replaying the event over and over and the consequences of that event over and over. And that keeps that wound green. It keeps it new and hurting me again and again. So by forgiving, I reduce rumination, and rumination is related to almost every mental health disorder that we can think of. It's related to depression, to anxiety, to post-traumatic stress disorder, to obsessive compulsive disorder, anger disorders, psychosomatic disorders. Therefore, good if we can reduce the rumination through forgiving. The third category of benefit is physical health benefits. These benefits take longer to accrue. Now, I can feel a change if I forgive. I can feel a change in my sympathetic nervous system response. I can know, from feeling that this is lowering my blood pressure, and that eventually could reduce my risk of cardiovascular problems. So I can see that there might be some long-term effects of forgiving physically, but usually they take time for the effects to show up in my body. Forgiveness can be a protective factor for a population. So forgiveness can help entire societies or communities. And of course, the way that it does that is by working through individuals, but also people who are in charge of governments can make statements that promote more forgiveness throughout the society. Forgiveness can be a protective factor because it can lower the chance of worldwide conflict and maybe lower the chances of war and deaths and injury that come from war, and also trauma that comes in war. And also it can improve mental health through less conflict and more social support, and improving civic relationships and making group relationships more harmonious, such as in work or religious organization or communities or across societies. And forgiveness can contribute to better stress management. So how can we forgive better? Well, in 2022, this year, there are over 100 randomized controlled trials that study the effectiveness or efficacy of forgiveness interventions. In 2014, we did a meta-analysis on the available studies at that point. There were about 67 studies at that point, and we found 4 things. We found, first, these interventions to help people forgive work. They do produce forgiveness. Second, that established programs all have about the same efficacy per hour of treatment. It's roughly about 1/10 of a standard deviation of change per hour of treatment. So what that means is time is vitally important. Time spent trying to forgive is actually more important than any particular intervention that might be tried. Now, of course, I've developed an intervention called the REACH forgiveness model, where REACH in English is an acronym that triggers the memory for different steps. I would love to tell you that that's the most effective treatment. I wish I could tell you that. I can't. That is just as effective as Bob Enright's process model or other models that have been tested and shown to be effective. None seems to have an advantage. So those two models that I mentioned, my REACH forgiveness model and Bob Enright's process model, have far and away more evidence supporting them than any other model. In fact, in the 2014 meta-analysis, there were 23 studies, randomized controlled trials that investigated Enright's method, 22 that investigated the REACH forgiveness model, and only 22 that investigated all of the other models put together. So there's a big difference in the way that these get used and studied, but they are all equally effective once they've been studied and shown to have evidence supporting them. So let me just tell you a little bit about this REACH forgiveness model, since I'm most familiar with that. And generally, in order to help people use that model to forgive, one of the things that we ask them to do at the beginning is to recall the most difficult thing that they have ever successfully forgiven. People either write that down if they're filling out a do-it-yourself workbook, or they share it in a group if they're involved in a group. And by sharing or writing a description of this very difficult thing that they've successfully forgiven, people gain confidence that they can forgive whatever it is that they're struggling to forgive at this point. So a second thing that we have people do is to assess the forgiveness of a target behavior that they're going to work on. We have them assess this with a self-assessment so that when they fill that out again at the end of their group or their workbook, they are able to show themselves that they made substantial gains in forgiving. Other things we have them do are contemplate inspirational quotes. We have them define forgiveness as decisional and emotional forgiveness, so that we're talking about the same thing rather than letting people go off with their own idiosyncratic definition of forgiveness. And then we share the benefits of forgiveness, the relational, the mental health, the physical health benefits of forgiving, because that in itself has a therapeutic effect of helping them forgive. Once they have done all those preparatory things, then they are ready to work on this target transgression that they identified, this hurt that they want to work on, and they work through the steps of REACH forgiveness for building emotional forgiveness. So very briefly, it takes a long time to work through them, but very briefly to state them, R stands for recall the hurt. But they recall the hurt so that E, they empathize with the person or sympathize with the person who harmed them, instead of just replaying the hurt again and again in a rumination. So R, recall the hurt. E, empathize. A, they give an altruistic gift of forgiveness. It's altruistic, it's unselfish, because the person does not deserve to be forgiven. So people give a gift of forgiveness if they do indeed forgive. REA. C is commit to the experience of forgiveness that they have felt. So that they do that, they commit to that by either writing or telling other people, so that H, they will hold on to that forgiveness whenever they doubt that they have forgiven. So once they have worked through the 5 steps to emotional forgiveness, then they consider making a decision to forgive. It doesn't matter whether you make the decision first or have the emotional experience first. These are 2 separate types of forgiveness, but each one helps the other. And then finally, they work through a kind of a 12-step program to help them generalize the amount of forgiveness to other harms that they may remember in their past. Finally, they fill out the same assessment questionnaire so that they see that they made a lot of progress in going through this. Let me just say that we are undergoing a test of these workbooks to help people forgive. I've created a 2-hour Reach Forgiveness workbook, and the Templeton World Charity Foundation has funded a large study worldwide where we are running randomized controlled trials in 6 sites, very troubled places, to help people forgive. So these sites are Hong Kong, which of course has had its share of conflict recently, Indonesia, the Ukraine. There are 2 sites in the Ukraine that that are running forgiveness trials. Colombia, which had, of course, about 60 years of conflict before the peace accords about 5 years ago. And then finally, South Africa. So all of these are communities where lots of troubles have taken place. And we're running these trials with 600 people randomized to either waiting list or immediate treatment at each site. So that's going to be 3,600 participants, which is 1.5 times the number of participants as existed in all of the studies put together in that meta-analysis in 2014. So this is going to be a huge study in a very real world situation to see if these work.